So welcome to Medication 101. My thought with this series is that we would talk a little bit about medications at kind of a low level, basically not for people who are prescribing these medications, more for people who encounter them all the time in their work, such as social workers or therapists or family members or anybody else who knows people and they get a drug list and they say, gee, why are you on this? It's also a good idea for patients to have sort of an idea of how doctors think about prescribing medications, especially psychiatrists, because I'll get a question all the time like, gee, doc, I have anxiety. Why do you have me on an antidepressant? Or commonly, with my patients who have OCD, once again, why am I on an antidepressant? Or why do you have me on Abilify? I looked that up online, and that turns out to be an atypical antipsychotic. What does that mean? It says it's for bipolar disorder, but I have OCD. I don't understand. So a general understanding of why we use certain medications, kind of a big classification system that you might be able to understand what medications are used for what is an SSRI medication, what is something that we use for depression, what is something that we use for anxiety, why do we use the same medications at the same times, why do we sometimes add medications. I think that would be a really good topic for this particular series. Another thing I'd like to talk about, and today I'm going to talk just a little bit about this aspect. I want to talk about why doses are different for certain medications. That's very confusing. One person will be like, I'm on such a huge dose because it's 500 milligrams, and another person on a totally different medication will be on 5 milligrams, and they'll get very confused thinking, why am I on such big doses or low doses when they're not the equivalents? And I think that would be a good thing for us also to talk about. And finally, I thought I'd at least mention or touch on the idea of Schedule II medications. People get very confused as to what that means. There are certain medications like opiate medications, benzodiazepines, stimulants, and these are what we call scheduled medications or Schedule II medications. And what does that mean? Why is it harder to get those medications from doctors? Why is it harder for doctors to get those medications filled for patients? So I'd like to talk a little bit about that as well. So without further ado, this is going to be Medication 101 for psych medications. So the first thing you ought to know is that no two medications are created equally. And this is even true of medications that are similar or act similarly. For instance, I'm going to have a whole episode on the SSRI medications, some of the most common medications that we prescribe out there for multiple things. But, you'll take one medication like Zoloft, and the prescribing will be between 50 milligrams and 200 milligrams. Or you'll have Prozac, and that will be dosed from 20 milligrams to 60 or 80 milligrams. So someone will be on 20 milligrams of Prozac, somebody else will be on 100 milligrams of Zoloft, and people get to thinking, wow, that's such a huge difference. Why? And it has all to do with how the medicines are absorbed. Certain medicines are easily taken up by the body. Swallow them, they get absorbed, they build up in your body in the bloodstream very fast. And so you don't need much of it. Just a little bit goes a long way. And that makes sense, right? And other things, they are just not very well absorbed, or they're not very well distributed in the body, or metabolized, which is a fancy word for basically breaking them down into their effective parts. And for those medicines, you may have to give them a lot more in order to get an effect. A good example is, we use 650 milligrams of maximum strength Tylenol, and that, we compare that to, say, something like 2 milligrams of risperidone, which is a medication we use. It's an atypical antipsychotic. I'll be talking about it. But 2 milligrams versus 650. There's just no equivalency. The risperidone is so much more potent. It absorbs so much quicker. You don't need much for it to do its effect. So once again, this is going to be kind of a simplified version of medications. I'm not going to talk too much about half-lives or things like that. Although, now that I think about it, I explained it to a 14-year-old the other day, and they seem to get it just fine. So maybe we will talk a little bit about half-lives because it's an important element to medications as well. But so that's kind of why we don't compare doses. Comparing a dose of one medication to another dose of another medication is like truly comparing apples and oranges. they don't have any correspondence, so you can't think of it that way. The other thing is, let us talk about half-life for a minute. All that means, it's interesting because the reason I got into this conversation with this 14-year-old was he said, that sounds like radiation. Why are we talking about radiation? You're giving me a medicine. And the reality is it just means the time it takes for the medication to go from one dose to half that dose. So how long it takes to drop down in your body, to reduce the half-life. How long does it disappear out of your body? And that's important because some medications have long half-lives. Those are the ones you only need to take once a day because it may take 12 hours for that medicine to reach half its original dose. So it breaks down slowly, it leaves the body slowly. Another medicine may have a very short half-life. It may break down in 1 or 2 hours. Those are quick-acting medications. Those are the ones that can kind of hit you faster, but they also generally come off faster. So we have to use them more often, 3 times a day, 4 times a day. This is especially important in antibiotics because some of them have very short half-lives and you want to keep that medicine in the body. So if it keeps dropping down to half its original dose in 2 or 3 hours, you need to keep adding back the medicine to keep the dose up at a certain level. Once again, that's half-life. And that just explains the length that a medication takes to act. We'll mention that a little bit, especially in things like benzodiazepines, and we're going to have a whole section on that one. It really matters how short or how long-acting the medication is. Pain medicines are another one, that same kind of thing, long-acting, short-acting medications. Now, that sort of relates, what I just said, to this idea of what we call scheduled medication. Scheduled medication is medications that are, for one reason or another, more controlled, most likely because they've been abused, have abuse potential, can become addictive, misused, basically. And so any medicine that can be misused recreationally or, like the opioid crisis that we have now, opioids were originally pain medications, like codeine and morphine, and all of those were originally specifically for pain, but they also had the side effect of giving people euphoria and helping them forget their problems. So they became medicines of abuse. This is why we take that class of medication and we make it that much more difficult for it to be prescribed. As a matter of fact, you have to have a special license, and most practicing physicians do. It's called a DEA, or a Drug Enforcement Administration license, to be able to write prescriptions for those medications. That includes the benzodiazepines. It includes the stimulants that we use, especially in ADHD. It includes opioid pain medications, certain other pain medications. Just as an introduction, once again, medicines have different characteristics. And we'll be talking about each of the different illnesses: depression, anxiety, OCD, schizophrenia, bipolar disorder, and several others. And we'll talk about how we use certain medications in that group, why. A little bit about side effects and things that I think everybody should know about these medications, as well as just some general facts about how useful they can be or overused. More than anything, I hope this will just give you a chance to be a lot better educated on what your patients are taking, what your kids are taking, what your family members are taking, or what you're taking. And we'll see how that goes going forward. So sit back and enjoy the ride.